Hi, I'm Daisy, I'm a chiropractor at Attend to Health. Today I'm going to be talking to you a bit about acute low back pain and how we can manage it here at Attend to Health from chiropractic care. So acute low back pain is any back pain that's been present for less than 6 weeks. It can affect anyone, all abilities and ages, and most of us will get a flare-up of acute back pain at some point in our life. Most commonly it's triggered by sudden injury to the muscles or ligaments or the joints in the lower back. Often it's a case of the back doing something it's not prepared to do. So for example, if you're at the gym and you suddenly increase the weight too quickly, it can cause the back to get injured. Or if you're not used to, lifting a sofa and then you go and lift some sofas, moving house, it can all contribute to flaring up the muscles in the back. But reassuringly, most of this back pain is in the 95% of back pain category, i.e. it's not caused by anything sinister or to worry about. It won't generally be caused by anything too serious, and it tends to get better within about 6 weeks, sometimes a lot less, sometimes it can take a little bit longer and need a bit of help. So really the first thing to do if you're having acute back pain flare-up is to stay calm and not panic. I know it can be quite stressful. Secondly is to keep moving. So originally it was thought that rest was best, but keeping moving gets the blood flow going to the back, helps stretch out the muscles, so that's really key. And then thirdly, it's recommended as well if you need to take some anti-inflammatories, that's fine to do so, or if you need to speak to the doctor for something stronger, like some muscle relaxants for the short-term relief, that can help you get you back on your feet. And then the same with heat and ice, both can be really useful. So ice is great if you're in a lot of pain. It actually works as what's called an analgesic, so it calms down that pain. And then the heat's good for things like spasms, where the muscles are getting really tight, just to kind of relax the muscle fibres and help you. Also works as a pain reliever as well. So either one of those is really good. And then as well, chiropractic management can be really useful. So when the muscles and the joints get quite tight, we can help by getting you moving a bit better. So by releasing the muscles with some massage, soft tissue therapies, and then mobilising the joints or manipulating them if that's appropriate to try and get everything moving better. And then we can also prescribe you some exercises which we'll go through, and these will help by relaxing the muscles, getting you feeling more confident, and then we'll work on ones to strengthen your back after everything's calmed down so that it doesn't hopefully reoccur. So we're going to start by going through some of the exercises. Obviously, speak to your professional, your healthcare professional that you're seeing before you do any of these, just in case they're not appropriate for you. But generally, these ones are quite gentle and can be quite effective in the early stages. So the first one is going to be called a rock back. So you're just going to get onto the floor or onto your bed, anywhere that's comfortable. Have your hands underneath your shoulders, knees underneath the hips. Bring the knees a bit wider and the toes together. And you're just going to work on rocking the hips backwards towards the heels and then forward. So it's a fluid movement. And just go as far as you can. If you can only get to here before the pain starts, that's fine. You can work within your pain-free area. But if you can go all the way, that's fine. So there's no magic number of how many to do, just as long as you're doing about 10 to 20 or so at a time, like little movement snacks. Then the next one is the cat camel, the cat cow. So first thing you're going to do is look up and then drop through the back, roll the shoulders away from the ears, and then reverse the arch. So looking at the belly button, drawing the pelvis closer to you. Really try and press into the floor, push the back up, and then roll through a few of these. Just like that. It's a really good mobility exercise. You can do it in the morning, evening, or whenever you get some discomfort. And then the next one's called the bird dog, or also known as the Superman. So we'll go through this one in stages. So the first thing, again, to making sure that the wrist is under the shoulder and it's not kind of back here. Same with the knee under the hip. So level 1 is just trying to keep the pelvis nice and still and just extending one leg back. So strong kick with that back leg, avoiding tilting the pelvis. So you want it nice and still, and just working on holding that for a few seconds or as long as you can. It's a really good strengthener for the lower back. And then if that's okay, bring it back in. And then the next level, trying to bring the knee off and then the opposite hand. So it's a bit more of a challenge for the core and the back. And then the last stage is trying to bring off both and holding that for a few seconds. That's helped giving you a bit of an introduction into acute low back pain and little things you can do at home. But with the exercises, if any of them cause you pain, to stop and then seek, medical attention, or speak to someone here at the clinic that you can get advice on what to do. But what is really useful, if you're not sure on who to see, because we offer quite a few services here, book in a free 15-minute chat and then someone can help you figure out who's best to see and how we can help.